Hi, good morning, everyone. It's nice to see everyone out walking, and the weather is starting to get a little bit better too. So I'm Lauren, and I'm a third-year medical student at WVU. So I was just going to give everyone a quick overview of what to expect for the next hour as we walk together virtually. Oh gosh, my dog sees a dog. Come on. Making me lose my train of thought. Very distracting. So I'll give everyone a quick overview of what to expect over the next hour as we walk together. So today we have Kristen McCartney joining us to speak about the topic of food insecurity and health in West Virginia. And then as we walk together virtually, she can answer questions that people have. Everyone should have received a pop-up notification in the on your phone or on your computer, wherever you're listening from. And that's just to consent to the audio recording of this walk. And only the audio portion will be made available publicly on our YouTube channel, which is WVU Walk with the Future Doc. And our Facebook page is also the same name, WVU Walk with the Future Doc. And that's the best place to look for updates about our future walks and the times and the topics. So thank you everyone for joining us today. Now I'd like to introduce everyone to Kristen McCartney, who's a public health specialist with WVU's Extension Services Family Nutrition Program. And we're excited to have her join us and speak today about the topic of food insecurity and health in West Virginia. So I will let her begin.
Hi, thanks for having me. Such a good topic, and just a little bit about my background. So I started my career and continue to be a registered dietitian. So obviously have always been focused on food and nutrition, and started as a clinician, in an outpatient setting, working with people on weight loss. And when I was thinking about what I was going to say this morning, it occurred to me, as a clinician in the outpatient setting, I honestly didn't consider food security in my screening of patients or my discussions with patients. And, as a dietitian, that seems like that would be an obvious thing to think about, but I really didn't. And maybe it was just my own life experience of not having to deal with food security as a child or a young adult. And it just wasn't in my frame of reference. So I think, as clinicians or people in healthcare or public health, it's just important that we realize that, this is a real thing in the state. And West Virginia has about 16% close to of food insecurity, and poverty, which is a big contributor to that, affects about a quarter of the kids in the state. So it is an issue, and it's something we need to be aware of because of its impact on health. And there are things we can do. So I guess, my work now is more focused around how do we resolve that? What are things we can do in the state to help with that? And what are kind of the federal programs that exist? So my current role, I'm the SNAP Ed director for the state of West Virginia, and SNAP is the food stamps program, SNAP or EBT. So that's one way that the federal government is addressing food security by providing people with money to purchase food. But there's some other programs too that you may not be aware of, or you may not have thought as food security programs. And those are the school lunch program. So, free breakfast, free lunch for most kids in schools across the state right now, especially with COVID. Those are food security programs. And then there's also WIC, Women's, Infants, and Children, which addresses food security for pregnant mothers and young children. So those are programs that are looking to address food security, but there are issues with those as well. Because food insecurity can be caused by a lack of financial resources, but there are other things that tend to affect people as well when it comes to accessing food. One being transportation, which is usually an issue with people with lower incomes. And another is just access. There tends to be, for low-income populations, or even not, where we live has a big impact on being able to access food. Even if you have the financial resources, maybe they're just not available close to you, or maybe their healthy foods aren't available. So when we look at the location of grocery stores or supermarkets that carry the healthy foods that we need, like fruits and vegetables and low-fat dairy and lean meats, in a lot of rural areas or sometimes in urban areas, in cities, there just isn't a place to buy those types of foods. So people end up doing shopping at convenience stores or grocery stores with limited food availability. And sometimes, in our most rural areas where people tend to have less money, those things are more expensive too. So there are a variety of things that impact food security, whether it's access or income. One thing that I think about with kids is, they do have some food access issues related to the preferences of those around them. So if a parent doesn't like fruits and vegetables, then it's likely a child won't have access to those things. So, I think about it in a variety of ways. And, the risk to health, obviously, if you go through periods of extended malnutrition, you're going to have those health impacts, of learning disabilities and anemia and, those very clinical things. But it also sets up a kind of pattern of behavior that we've seen, for kids, especially if they're at home where they don't have food access and then get to places where they do. There's, the tendency to binge and create unhealthy eating patterns. A lot of food insecurity kind of tracks with obesity, which can be because cheaper, carbs and things like ramen noodles, are staples because that's what they can afford. And then another thing to think about is, the choices that are being made by people with limited resources. It's a choice of buying healthy food or putting gas in the car, or, if they are struggling with a chronic disease, it's the cost of medication or the cost of getting to a physician's appointment. So I think even as future doctors, the reality of your patients not being compliant because they don't have the resources financially to follow all the recommendations, I think is important to think about. One resource or one group of people that I have linked up with, no pun intended, is West Virginia Food Link. They're with the Food Justice Lab or the Center for Resilient Communities at WVU. And they, several years ago, mapped the whole state for all the food resources available. So by county, you can actually pull up a map and see where all of the supermarkets are, where all of the convenience stores are, where all the Dollar Generals are, where all the food pantries are. And so, as a physician, if you want to link your patients to food resources, that is available. And there's a ton of information actually on that site about food security and efforts to change the food landscape in the state. So that's one resource, but food pantries tend to be kind of that safety net for folks who are really struggling with food security, and they've seen quite a spike in participation over the past several years, even before COVID. But as you can imagine, they're reliant on donations and whatever is available through those resources, and those tend to be not healthy foods a lot of the time. So we've been to different food distributions helping out, and sometimes it's big fryer chickens and sometimes it's packs of Sour Patch Kids. So those things can be helpful, but also they aren't always going to support healthy eating. They may fill an empty stomach, but not necessarily nourish folks. And then on the flip side of that, sometimes when they do have healthy foods, people don't have the skills to cook or prepare those items. So they're skipping out on, a nice beef roast or something that would have a lot of protein and nutrition because it's not familiar, or they don't have the knowledge about it. So those are just some of the thoughts that I have and experiences I have around food insecurity in the state. So like I said, with SNAP Ed, which is what I direct, we have educators around the state who work in schools or in drug recovery centers or with food banks to help teach people how to cook, why nutrition's important, how to balance their diet, how to shop and save money. But they also work on projects that can help improve access, working with farmers to set up farmers markets. We work with our partners at Food and Farm Coalition to support SNAP Stretch, which is a program that allows people to double or triple their money at farmers markets. So that helps them overcome that financial access issue. Just a variety of things, really looking to build capacity in our local food network, because the other thing I think about with food security, there's kind of the acute individual issue, but there's also a broader food security issue that we need to think about. And that relates to things like, climate change, or even with COVID, there was, I think, people started thinking a little bit more about where their food came from with the grocery stores closing down, and, kind of this fear of what was going to happen. And what if the grocery stores closed down? What if those pathways for food distribution were interrupted? And what is our capacity in our communities to actually grow the food that we need locally to make sure that people don't go hungry? So, there's kind of a broader thought of community food security and the ability of people to grow their own food or secure food through local sources, and not be so reliant on kind of a global or national food network. So that's just another thought. All over the map, I'm sure, but.
All right. Well, thank you so much, Kristen, for talking and starting us off with a good conversation today. I'll start you off with a question, but I want to let everyone else know that if you have a question or a topic you'd like to bring up, you are more than welcome to unmute yourself and ask it out loud, or you can send the message in the chat. You can send it to me. My name is Mia, and I'm a second-year medical student at WVU, or you can just send it to everybody, and we will make sure that your question gets answered. So, Kristen, I want to know how you arrived at this position in your job, and how you think you've impacted the state.
So I, like I said, I was an outpatient dietitian at CAMC working in weight management. I love that job. I love working with people. I loved helping them, to make changes to their diet. But I just got to the place where I was looking for something different. And actually, a position with the Cardiac Project came open. And I'm not sure if you're familiar with that, but the Cardiac Project was a high cholesterol screening program that Dr. Bill Nill, who recently passed away, started, pediatric cardiologist, to identify people with the genetic hypercholesteremia. So anyways, that program had expanded and became a school-based obesity screening program. And I ended up working with them, being their first dietitian. And it transitioned me from that, individual focus to more of that broader community focus of health and how to impact people. And honestly, with my many years in weight management, you talk to people, and as doctors, you'll do the same, and you hear their stories, and especially around weight loss, just understanding that people do have the ability to make different decisions in their life and choose different foods. But there are so many things that influence that, and they can be, you know, related to their family, and they could be related to their school environment or their work environment. And so that got me really interested in public health, and I got my master's in public health, and then worked on an obesity project, childhood obesity project, as a program coordinator. And then this job with Extension came open with a family nutrition program, and it really allowed me to build a menu of programs to address food access in the state. And then also another one of our major targets is sugar sweetened beverages. So we have these kind of primary goals. And like I said, we have our educators that are out there teaching people at the individual level, trying to help them gain those knowledge and skills that they need to make better choices. But then we have kind of these overarching programs that we're working on to facilitate changes in behavior through, you know, like I said, establishing farmers markets, doing campaigns, promoting connections between healthcare and communities, and a variety of things. So my biggest impact on the state, I would say, has been in the agricultural sector, because I had started in 2014 this kids market program with a small grant from the Conservation Fund in McDowell County. And all that was just bringing farmers to the schools and allowing kids to shop using those grant funds, pick out their own produce. And, you know, it was great. As a dietitian, it was what I wanted, you know, to see kids eating healthy foods, to be excited about fruits and vegetables. But what I didn't anticipate or think about was the impact on capacity for those local farmers. So we really expanded that statewide. To date, with all of the grant funds and different programs that we've done, I think we have probably put about $200,000 directly into the local food system. We've kind of changed the way that farmers work together. They, instead of just setting up at a farmer's market and waiting for people to come to them, now we do kids markets where they go to the school, and we do pharmacy programs where they go to a health clinic, and we connect them with food pantries so they can donate any of their excess produce. So those are the things I think that I feel like I've had a big impact on in the state.
Very cool. So we have a lot of physicians on the phone today, and we also have quite a few med students. And so I wanted to know, so if a patient like comes to the clinic and you notice like food insecurity, what are some of the what are maybe like the top 3 resources that you think that maybe you might want to like talk to your patient about that are offered through things that you do?
Yeah, so you know, there is a food insecurity screener, and we've been working with some clinics on trying to get those incorporated into the electronic medical record. Just that way it's a prompt to talk about those things, you know, and not make assumptions about where we think people stand. So that's one thing I think could be done, is just make sure that's part of a screening process, so that conversation can be started. And then the second thing, like I mentioned, there are federal programs. I mean, some people don't realize that they might qualify for SNAP. So, you know, if you find that someone is struggling with food, you could always direct them to the DHHR to see if they qualify for SNAP or EBT. There's also, if it's a pregnant mother or someone with young children, there's WIC, which is a supplemental program that can provide really healthy foods, a food package. And I think most people with children are probably participating in school meals, but that's another resource. And then, like I mentioned, West Virginia Food Link, there's a map of all the food pantries in each county. So, you know, you can always direct people to those resources as well, as a way to get emergency food if they need it.
I have a question. You talked earlier about how people might bypass a beef roast because they don't know what to do with it. What sort of education have you found seems to make the biggest impact on making people not pass up that beef roast?
Yeah, cooking, food preparation is a big part of it. We try to do education. Well, we have classes, which is, are a series that we reach people, but those are usually at places where people already are. Like, we've had a lot of success with some drug recovery centers where people are living there, and we can go in and really demonstrate how to do different cooking techniques and provide some in-depth nutrition education. We do at food pantries, if we can find out what they're going to have as far as what kind of foods are coming in, then we can prepare recipe cards and things. But that's not the ideal. With cooking, you really want to do hands-on demonstrations and teach people the skills. So really the classes have been key when we've been able to work with people over a period of a few weeks and teach them those cooking skills. I think that's been the biggest impact that I've seen. It's a little harder to do it when they're standing in line, waiting for their food pickup. So we're trying to be a little more proactive, and we started that, with we have a curriculum called Teen Cuisine. So, some of you may remember, and it does exist kind of sporadically around, the home economics classes where you learn to cook and sew, and those things have kind of gone by the wayside. And so our educators have been going into middle and high schools and teaching a class called Teen Cuisine, sometimes during health, where they teach, young people how to cook. And I think, we always talk about prevention and you want to work with the people who need it when they need it, but we're also trying to start young and make sure that people have those skills before they enter into the world and, get in those situations. But we try a variety of methods, but the best is actual in-person cooking demonstrations and classes.
What do you think we could do in an office setting that would be effective?
I think, the best thing probably at that place is referral. And like I said, I have a strong desire to try to connect what we're doing in the community with clinicians, because, I understand too, as a dietitian, that's all we talk about is food with people. But as a physician, you've got to cover medications and, vital signs and all these things. So there may not be an opportunity to go as in depth as you need to on nutrition and, how to cook and that sort of thing. So I think knowing where to refer people is a great first step. And right now we have a ton of virtual classes just because of COVID. So, it's accessible in a way that, if people lack transportation, as long as they've got some internet access, we have some virtual education, so we can create a list of folks interested in a class and set a class up virtually or in person. The extension offices are good places to refer people as well. But I think that's the biggest thing as a clinician, is knowing where to refer people to get those resources. And I think there's ways that you can highlight choices in your offices too. We talk about, there's a behavioral economics concept of, what kinds of magazines are in the office, what kinds of pictures are hanging on the walls, what messages do those send? What if you had promotions for the local farmers market in your office? And, I think there are ways that you can, show the linkages between what's healthy and what's good and the patients as well, without having to do a lot of effort.
Do you think the virtual classes will persist for people who do struggle with transportation?
I think so. It was a little rough for us to get those up and running. And, we've obviously had a decline in participation because we haven't been able to access those in-person classes. However, we have seen that now that we have those in place, the people that we are reaching are our target audience, low income folks. And we're able to screen and make sure that we're reaching them as well. So I do think, there are some benefits of COVID and what it's brought, and creating this way to access people virtually has been one of them. And that makes it easier to refer, because like I said, in general, our classes, we don't just kind of advertise to the community, hey, we're doing a class. We go somewhere where there are already people, like, adult education or drug recovery. So if folks aren't in those places, but they still need the services, this gives us a way to access them.
Maybe utilize this infrastructure you already have and live stream some of the live classes when they come back.
Yeah. I definitely think, because it's easy for our educators, we have educators all over the state, but a virtual class anyone can teach, it doesn't, so anyone who's available or doesn't have a class going on can jump in and teach that virtual. And they're working on it. I mean, it's all new for our staff, but they're getting better at it. We've talked about, even like, we've got YouTube videos on recipes, demonstrations. Then we've talked about, that would be great to put in DHHR offices. And, there's a way to kind of just communicate with people, even, without having a class. Those are ways we can all support each other's messages. And healthcare providers are the number one trusted source for, information about health and nutrition. So the more that we link up and have the same messages, I think the better.
Kristen, I think you were talking a little bit earlier, it might have been even before we really started the walk, about like gardening programs. Could you talk a little bit more about that?
Sure. So one of the ways that we're trying to address food security, obviously, if people know how to grow their own food, that's a big source of food security. So we've done gardening, since I've started in this position, with schools, with community gardens, even with our adult classes in the day reports or wherever we're at. And then we had started this program called Grow This, which was, more of a social media. It's on Facebook, just a promotion of gardening and kind of a celebration of it. We started that in 2017, and we had about like 200 or 300 people sign up each year. If they signed up on Facebook, they could get free seeds, and then we would post information about how to grow and some challenges. And it was just kind of a fun thing. But last year with COVID, we went from 200 to 300 people signing up to 26,000. So we had quite an increase in participation, but, people were more interested in, like I said, COVID was something that people, got people thinking about food and where they access it and being healthy, and which is great. That's what we wanted. So Grow This is one of those outreach strategies. And this year we've had 17,000 people sign up, and we send them seeds, and then we post videos and different things about gardening. But also last year with COVID, we, a couple of our educators worked directly with families on starting gardens, because that way we're able to social distance and not have big crowds of people. So it was a really impactful thing that they were able to kind of work directly with folks and establishing gardens and following through with that and harvesting. So it's definitely something where we promote and are interested in and support. We have our educators in Cabell County have done an amazing job. One of our educators, her mom donated some of their property, and they started with this garden and have grown it every year. And those two educators invited families to come, and they let them pick, and they showed them how to clean and harvest things. And then they donate everything they have extra to families or to food pantries. So, it's just been amazing. Our educators are very passionate and very dedicated to serving the community. So gardening, yeah, I mean, is a great referral And if you haven't seen, I mean, the other kind of direct connection with healthcare that we do is the pharmacy or the produce prescription programs. And we had a big grant from Walmart this year, last year, to work with 10 counties on connecting clinics with local farmers through basically prescribing fruits and vegetables and then having those markets set up at the clinic site. So that's another really kind of direct connection. And then some clinics or some sites that we've worked with have established gardens at their clinic site for people, again, it's just kind of a message of this is something that's healthy and also as a outreach strategy. So those are ways we can also connect.
What's the status of the Grow This program this year with the seeds?
It's so we had about 17,500 sign up. This year we do certain crops every year. This year we're doing a Three Sisters garden, so it's corn, squash, and beans, and you grow them together in like a kind of a teepee. And so we are hoping to get the seeds early April, get those milled out, and then we've got a ton of videos and education on how to grow that. And like I said, we do some challenges. We've also done some microgreens this year, and we kind of have built upon each year. We build upon what we've done before, but right now, if you want to go sign up or just follow, well, you can't sign up to get seeds, but you can follow the site. It's just Grow This WV on Facebook. We have a poll out for what crops people want to see us grow next year. So you can respond to that. And also, even if you don't get the free seeds, you can follow along and go step by step on how to grow your Three Sisters garden.
That is awesome. I love that. I haven't gotten the seeds before, but I have friends of mine who've received the seeds, and that's so cool. And I'm excited that the program just keeps like growing. 17,000 is a lot of seeds to be mailed out.
We were like a little bit overwhelmed last year, but it came at the best time because our staff were feeling a little defeated because they weren't able to do their typical jobs, but they got really busy packing up seeds last year, and it gave them a purpose. And that was what I think a lot of people who signed up for the program, they needed something to focus on, and growing their garden was something for mental health as well, which we kind of discount, and is also a big part of food insecurity, that stress of not knowing where your food's coming from or if you're going to have food. And so gardening is physical activity, it's health, it's nutrition, it's it's got the full package there. So we love it. It's a great program, and we're able to engage a ton of people through that.
Yeah, that's so awesome. Are there any other programs that like that one you can like follow on Facebook and follow along with what's going on?
We have a YouTube, so West Virginia Family Nutrition Program. We have a YouTube that has a lot of our recipe videos and things on it. We have a Food of the Month program, but we haven't got that. We're actually getting ready to hire a social media specialist because, even just Grow This, the one Facebook page takes a lot of effort to kind of keep it rolling and keep it coordinated. So I think we'll expand and have some other ones as well. But right now, it's just basically our Grow This, and then we have our Family Nutrition Program, YouTube and Facebook pages.
Awesome. And can we switch gears a little bit? Could you talk a little bit more about like what's going on at the schools, just through kids?
Sure. Yeah. So, I think COVID has had a huge impact on food security for children because, most kids rely on those breakfast, lunch, and in some counties they have dinner as well. Programs for, that is their nutrition. So obviously when school is out, those meals aren't available. Now, schools have made efforts to get those meals to kids, but as you can imagine, their pickup, they'll pack up the meals and have them at the school for families to pick up. But like I mentioned, people with food insecurity tend to have issues with transportation as well. So, I imagine there's a lot of issues with kids getting the nutrition that they need through this pandemic. But schools have made a huge effort. The federal government has basically waived a lot of the accounting structures for, if when I was in school, we had lunch bills, for your school lunch, and a lot of that cost has been waived. So everyone can eat for free. And there have been a lot of waivers for how food's delivered, and that will continue into the summer. So there's also summer feeding programs. And those generally happen at the school, but they can happen at other sites as well. Like, if there's a 4-H camp or a Girl Scout camp, or if there's a church summer program, those organizations can apply to be a summer foods site, and they can get reimbursed from the government for serving those meals. Now, they may only get, I don't know the exact amount, maybe like, $1 for breakfast and $2 for a lunch meal, and maybe that'll cost more from what they serve, but they can at least get some reimbursement. So the criteria around those programs has been loosened a little as well to give more flexibility to how those foods are delivered. So instead of, it used to be, the child had to come to the site, and now there's a lot of pickup options. Good or bad, there's only so much that you can pack into a bag that's going to stay food safe and all of that. So that does impact the nutrition, but there are some guidelines around that, what has to be included to make it at least somewhat balanced. But prior to COVID, there's something called community eligibility provision. So schools could apply to serve free meals to all the students, regardless of income, if a majority of students were low income. And they were able to do that because the cost of billing and administration, kind of outweighed sometimes the just giving everyone a free meal. So there is that. And a lot of the state had adopted that prior to COVID anyways. So those are ways that school meals can help prevent food insecurity, but it's definitely been impacted, and it's impacted our kids market program, where our goal was to really allow kids to interact with farmers and interact with the market experience. And due to COVID restrictions, we have to pack everything up and give it to them, and they don't really get the choice. And so that's kind of been a big bummer for us too, but people are still out there working on getting food into the hands of kids. And we have a great partnership with Mountaineer Food Bank. There's 2 major food banks in the state. There's Mountaineer Food Bank, which serves a majority of the state, all of the northern part, and down kind of past Charleston a little bit. And then there's Facing Hunger Food Bank, which is in Huntington, and it serves fewer counties, maybe 10 or 11, kind of in that southwestern side of the state. And we do partner with both. We partner more with Mountaineer, and they've adopted our kids market model. So when they go to a school to do food distributions, they set it up like a market, and kids pick. And so we've been able to collaborate on that, but they're going strong with their food distributions as well. So we do have a lot of efforts targeting kids.
Very cool. I love that it's targeting kids as well.
Mm-hmm.
Yeah, so if anybody has any more questions, we're getting close to the end of the hour. You are free to unmute yourself and ask them out loud, or you can send them in the chat, either to everyone or just to me. And my name is Mia again. Kristen, another question for you is, what is your favorite program? Something that you think that is really impactful?
Well, I like the kids market program. I really do. I mean, I've loved that from the start, and it all started with working with adults. I mean, the biggest thing I noticed when I counseled adults is they didn't like fruits and vegetables, or particularly vegetables. So, you know, and it's really hard to change once you become an adult and you have these established food preferences. So, you know, I started when I was in cardiac, and we did this kind of like food fear factor. I called it Veggie Tastings. And so I would go into the school with just different cut up fruits and vegetables, and well, actually just veggies, and give kids the chance to taste them. And it really made a huge difference. I had a school nurse once whose son participated, and she came up to me when we were there for a screening, and she said, you know, that ever since you did that, my son has been trying more things and been open to tasting. So, you know, I like working with kids. I like the idea that we can change the trajectory of their health by doing some of these smaller programs, and you know, maybe even influence adults through the kids, because it's hard to go the other way from adults to kids. So I really like giving kids that opportunity to have those experiences with foods that maybe they wouldn't have because their parents just don't prefer those things or aren't interested. So that's my favorite.
Yeah, well, thanks so much for sharing. And thanks so much for being our speaker again today. I'm going to wrap it up, but I wanted to ask you another question, just as kind of a take-home point for physicians or people working in the clinic, dietitians, if they want to reach out to your office or like want to refer a patient to some of your resources, what should they do, or where should they send them?
So we have, like I said, we have a Facebook, we have a website, but honestly, if they're interested in establishing kind of a referral system or want to reach out, the best way to do that is probably just to get in touch with me directly. So you probably have my information. It's probably on the flyer, but I'm at WVU. So my email is Kristen.McCartney at mail.wvu.edu. And so, you know, if there's some interest in that, we definitely have interest in connecting with clinics, and setting up some of those referral pathways, or just, you know, promotional things in your office or whatever you think might be good. So that's probably the best way.
Okay, great. And then just like a fun question for you, what's something you're looking forward to this spring as the weather warms up?
I am looking forward to kayaking. I got a kayak last year and started my kayaking adventures, but I'm ready to go a little deeper into that and explore some new creeks and rivers and streams. So that's what I'm looking forward to.
That's awesome.
Kristen, thank you so much for coming on and speaking today.
Oh no, I'm excited to see you.
You're definitely, like, Extension is such a gem, and you guys do so much that nobody knows about. So I'm so excited that you got to tell all.
Yeah, we're looking forward to making those connections for sure. Good seeing everyone.
Yes, awesome. Thank you so much again, Kristen, for joining us today. For those of you who walked with us this morning, thanks for getting out and being active, starting off your weekend right. If you wouldn't mind opening up the chat right now and typing who you are and where you're walking from. We're just trying to track how far our program has reached. I know Kristen was in Ritchie County today, so that's awesome. So we're moving our way across the state. So thanks so much, everyone, for joining us today. I hope you enjoy the weekend. Our next walk will be in 2 weeks, which will be April 10th. Same time, 9 a.m. Saturday morning. Walk with us for an hour, and hopefully we'll just keep enjoying the sunshine and the warm weather. So thanks so much, everyone. And thank you so much again, Kristen, for representing Extension Service today and telling us all about what you guys do.